Okay, hi, this is John. I'm about 48 hours post-operative. I had a single level L5S1 TLIF, and right now things are awesome. The operation went very well. I'm, 8 millimeters taller?
6 to 8.
6 to 8 millimeters taller than I was when I went in. I had a really messed up L5S1, pretty much everything wrong, and it's now good. Moved apart with spacers and instrumentation back. When I came out of surgery, as is typical for most people, I guess I was on Dilaudid for the first 24 hours, and I was up the evening of the surgery with no real problem. I got up and I managed to get myself into the bathroom. I managed to pee, no problem. They took the catheter out in the recovery room. That was fine, kind of painful. First pee is pretty painful. Some people, I guess it's more so that it was very painful, but it was manageable. And subsequent times peeing, like the first several times it hurt, but then that kind of just fades away. It's not that big a deal. So the first day was really quite fine. Pain was manageable. But the problem came on 24 hours post-op when they tried to get me off of the IV Dilaudid with the PCA pump, the thing you pump. Then everything went down the drain because they tried to put me onto Percocet, and it took what's one, honey? You can talk.
Don't move your arms because it shakes the table,
okay.
and then you get all shaky.
Yeah, good. So everything went downhill when they tried to get me off of the Dilaudid and the PCA pump, when they tried to put me on, transition me to oral Percocet. And it was awful. After the fact, I learned that I was essentially unmedicated for pain because I'm one of about 7% of the population that has a missing enzyme. We had a very good pharmacist here in the hospital who, once she figured out what was going on, she goes, "Oh wow, you must be one of the 7% that has this enzyme deficiency in your makeup such that certain pain drugs don't work, and Percocet is one of them." And so they were trying to pound Percocet in me, and they were giving me intermittent IV injections of Dilaudid, this and that, and the next thing, it was horrible. I couldn't even move. My breathing wasn't right. I was in a cold sweat, just curled up, laying on a bed. It was just brutal. So anyway, once she finally recognized that, she said, "Okay, you got to get on oxycodone," and then also put me on Flexeril, which is for muscle spasms, which I was also having. And after that kicked in over a matter of a couple of hours, taking that like every 3.5 hours, I'm perfect. I'm up walking around. And when I'm sitting still, and like I'm sitting in this chair, or even almost walking, I am almost pain-free, which is just amazing considering where I was 24 hours ago. It was just horrible. So if anybody ever has this done and they're transitioning you off of the Dilaudid and they're going onto Percocet, remember the fact that there's this, and it's 7% of the population, which is pretty big, that there's this enzyme, something missing in your genetic makeup is the way she described it. So that's huge. So other than that, I'm doing great. I'm up walking around as much as I want. No problem getting up and down out of bed. I'm using a walker in that, but I don't even have to. The biggest problem or challenge that I have now is wiping my behind after a bowel movement. And if it wasn't for my gracious wife sitting behind the camera now, I'd be, I don't know what the heck would do it. That's the big thing. I don't know where I'm going with that for the next several months. I'm wearing a back brace, so it's hard to say what. I'm still trying to figure that out, and I've looked a little bit online, and it doesn't appear that anybody's got a real good solution for that other than somebody else helping you. Constipation. I guess I've had probably an average case of constipation and difficulty peeing when you have these pain meds. A lot of times they have an effect that you can't get, the way they describe to me, you can't get a stream going, and once you do, it tends to stop, want to stop. It's very annoying, but fortunately the more you have to pee, the easier it is to go, but that's just a little bit annoying. But anyway, this minimally invasive procedure is awesome. I've never had an open one or never had anything else. But once I got the right pain meds, I'd be going home today if it wasn't for the fact that we live 2.5 hours from here. We have so tomorrow, the third day out of surgery, I'm going to be driving 2.5 hours, and they assure me that it won't be a problem. I think I'd rather lay down in the back of the car or something like that. But if I was going home, if I lived locally, 48 hours post-op, I'd be going home with no concerns, none whatsoever. So I know a lot of people have had a lot more pain thing going. I don't know whether that's a function of the pain management, a function of this minimally invasive procedure, or not. But so far, going very good once I got the pain under control.
Good.